Hello everyone and welcome again. So continuing our discussion about the clinical pharmacology basic principles class, and after we talked about the agonist dose response curves, now we are going to talk about the types of antagonists and the differences between them on the agonist dose response curves. It's also worth to mention that the agonist dose response curves video was the previous video, and it's important to watch it before watching this video to understand this video. And with that, let's start. So here we have some important information to remember from the previous lecture. So we mentioned before that when a drug combines with a drug target, and we mentioned that the drug targets are either a receptor, an ion channel, an enzyme, or a carrier molecule. And so when the drug combines with a drug target, this may lead to one of the following. We either get an agonist effect or an antagonist effect. The agonist effect is when the drug binds and causes the same action as the normal substance that binds to the receptor. While the antagonist effect, the drug binds and stops the action or effect of another substance. So in the agonist effect, we get the same action as the normal substance, while in the antagonist effect, the antagonist would stop the action or effect of another substance. And we also mentioned that the interaction between the drug and its target can be described by a curve, because the drug affects natural regulatory processes, so their effect follows a natural curve. Now let's talk about the antagonist types. So the antagonist produces zero effect in the dose response curve. It produces zero effect. And if the antagonist binds to the same position as the agonist does, then it is called competitive antagonist. So let's say if this is the receptor and the agonist is binding here on the receptor. If, let's say, the antagonist binds to the same position as the agonist does, so here we have the agonist, if the antagonist binds also on the same position as the agonist does, it's called competitive antagonist. If the antagonist binds to another position on the receptor and caused antagonism, it is called non-competitive antagonist. So let's say we have this receptor and the agonist binds here. Now if the antagonist, let's say, binds in the another position which is here than the agonist, then this is called non-competitive antagonist, because it is not going to compete with the agonist. Here the antagonist is competing with the agonist, so it's called competitive, while here it is not competing, so it is non-competitive antagonist. Now if the antagonist, which is binding to the same site here, binds to the same position on the receptor as the agonist does, and by weak bond, if the bond here is a weak bond between the antagonist and the agonist, so weak bond, then the antagonist here is called reversible competitive. So the antagonist is reversible because it is binding by a weak bond and on the same site as the agonist. So it is, because it's binding to the same site, it is competitive, and because it is binding by a weak bond, it is reversible competitive antagonist. So it is reversible because of the weak bond, it is competitive because it's binding on the same site. Now, if the antagonist bind to the same position on the receptor as the agonist does, and this time by a strong bond, it is called irreversible competitive antagonist. So if the bond here was a strong bond, so strong bond, this time, because it's binding on the same position, it is competitive, and because it's binding with strong bond, it is irreversible. Irreversible competitive antagonist. So increasing the agonist concentration while using the reversible competitive antagonist would reverse the antagonism, while it wouldn't if using an irreversible one. So in case of the reversible competitive antagonist, we mentioned that it is binding by a weak bond on the receptor site. So when we increase the agonist concentration while using the reversible competitive antagonist, the reversible competitive antagonist would unbind from the receptor and would let the agonist bind into the receptor. So we're reversing the antagonism here. That's in the case of the competitive antagonist, of the reversible competitive antagonist. But if we have an irreversible competitive antagonist, this time it is binding by a strong bond to the receptor site, so it is hard to unbind, and that's why we can't reverse the antagonism in case of the irreversible antagonist. Now most antagonists are reversible competitive, like atropine, which is a reversible competitive antagonist of the acetylcholine receptor. So acetylcholine receptor, and the beta blockers, which are reversible competitive antagonists of the beta receptors, beta adrenergic receptors. Now some drugs or some antagonists are irreversible competitive, like the phenoxybenzamine, which is an irreversible competitive antagonist of the alpha receptor. So it is irreversible competitive antagonist of the alpha receptor, and the organophosphate, which is an irreversible competitive antagonist of the choline esterase enzyme. So choline esterase enzyme. Now irreversible antagonists removed by the body after longer time than the reversible ones, because the body needs to autolysis the receptor with the antagonist and form a new receptor, because the drug is binding by a strong bond. So basically the drug is stuck with the receptor, and the receptor need to undergo autolysis to get rid of the drug, and this is the only way to get rid of the irreversible antagonist. So that's why the receptor would undergo autolysis. So now for the reversible competitive antagonist. So we mentioned that the reversible competitive antagonist is binding on the same site of the receptor of the agonist in the receptor. So it's binding on the same site as the agonist, but with a weak bond. So on the same site but with a weak bond. And let's draw the dose response curve to explain the curve that this antagonist produces while using the agonist. So we have the dose response curve. We have the response on the vertical axis and the dose on the horizontal axis. And let's start by drawing the curve of the agonist alone. So the agonist alone, So we start with 0 when we give 0 dose, but when we increase the dose, we start getting response until we reach the maximum response, which is the Emax. So here the 100 response, which is the Emax, and it is for the agonist alone. Now the curve for the agonist plus the reversible competitive antagonist. And we notice that when we add dose, we don't get the same effect in the beginning, so we get a little bit less effect. But when we keep increasing the dose and increasing the dose, we also reach the Emax, but this time with more dose than the Emax of the agonist alone. And that's because when we add more agonist, the agonist would reverse the antagonism, because the reversible antagonist is binding by a weak bond, and it is easy to reverse the binding of this antagonist, and it would unbind, and it would let the agonist, which is in high concentrations, bind into the receptor, and we also reach the Emax. So that's the Emax for the agonist plus the reversible competitive antagonist. Now the EC50. So we have here 100% of the effect. Here we have 50% of the effect. So the EC50 for the agonist is about here. So EC50 is the concentration that achieves 50% of the effect. So EC50 for the agonist. While for the reversible competitive antagonist would be right here. So it would be right here. That's the EC50 for the reversible competitive antagonist, and we notice that they both have different EC50s, and that's also something to note. So if we use reversible competitive antagonist as a drug in real clinical work, the body might have the ability to add more and more of the natural agonist and overcome the antagonist effect with time. So when we keep using the reversible competitive antagonist, the body could reverse the antagonism. It's a possibility for the body. And the EC50, as we mentioned before, for the agonist alone and for the agonist with the competitive antagonist is different. Now for the irreversible competitive and the non-competitive antagonists. So we mentioned before that the irreversible competitive antagonist would bind at the same site as the agonist does. So if it is this, the agonist, and here we have the irreversible competitive antagonist, it would bind on the same site as the antagonist, but with a strong bond. In comparison with the non-competitive antagonist, the non-competitive antagonist would bind at a different site than the agonist. So here we have the agonist, and the non-competitive antagonist would bind at different site than the agonist does. And so here we have the non-competitive, and this one is for the irreversible competitive. Now let's explain both of them on the dose response curve. So here we have the dose response curve. So here we have the vertical axis, which is for the response, and we have the horizontal axis for the dose. And first let's draw the curve for the agonist alone. So the agonist alone starts with zero dose, and it would increase until we reach max effect, which is the E max at 100 effect. Now for the irreversible competitive antagonist with the agonist and the non-competitive antagonist with the agonist, they both have the same curve with the agonist. So the irreversible competitive antagonist with the agonist have the same curve as the non-competitive antagonist with the agonist. And it looks like that. So we increase the dose, and it would be like that. We don't reach the 100 effect. The Emax would be less for the non-competitive, and the irreversible competitive would be less than the agonist alone. So here we have the agonist alone, and here we have the irreversible competitive plus agonist, or the non-competitive plus the agonist curves. And as we can see here, they both have less than the maximum effect. Even we keep increasing the dose, we still have less than the max effect. And that's because in case of the irreversible competitive, the irreversible competitive is binding by a strong bond. So even with increasing the dose, the irreversible competitive antagonist would still be binding to the receptors, and we don't get the max effect. We get less than the max effect. The same applies to the non-competitive antagonist, because it is binding on a different site as the agonist does. So we still have the antagonism even with higher doses. So we still have the antagonism, and we don't reach the max effect as in comparison with the reversible competitive in the previous slide, which is here. As we can see here, we reach the maximum, while here we can't reach the maximum. Now for the EC50, so half the max response is 50 response. And if we plot it here, we get the EC50. So the EC50 for the agonist alone, and for the agonist plus the reversible competitive or the non-competitive, they all have the same EC50. So the EC50, they all have the same EC50 in comparison with the reversible competitive plus the agonist. It does not have the same as the agonist alone. So body can't overcome the non-competitive antagonist, as we said. So effects are the irreversible competitive unless there is autolysis of the receptors with the antagonist. So the body can't overcome the effect until there is autolysis with the receptor. So the drug would be taken into the cell and would be autolyzed with the receptor. And the EC50 reached for the same dose for the agonist, and the agonist with the non-competitive antagonist, or the agonist with the irreversible antagonist. So EC50 is the same for both of them. In comparison with the EC50 for the reversible competitive, it would be different than the agonist alone. Now let's discuss other types of antagonism. So we mentioned before the reversible competitive antagonism, the irreversible competitive antagonism, and the non-competitive antagonism. And all of those involve interaction of a drug with a receptor. Now let's discuss antagonism that doesn't involve receptors. So not all mechanisms of antagonism involve interaction of drugs or ligands with receptors, and there's other types of drug antagonism that doesn't involve receptors. And example would be the chemical antagonism. So the chemical antagonism, if we mix an acidic drug with a basic drug, the acidic drug would bind into the basic drug, and it would lead to a chemical complex that would have no effect on the body. So this leads to precipitation, meaning we would have chemical complexes that would that is deactivated, so it would have no effect. Example would be the gentamicin, which is a basic drug, and the penicillin, which is an acidic drug, and they both antibiotics. So when mixed in the same syringe, when we mix the gentamicin with the penicillin, this would lead to a chemical complex because the gentamicin is basic and the penicillin is acidic. The other example is the physical antagonism. So in the physical antagonism is antagonism between two drugs carrying opposite charges. So one drug would have a positive charge and the other drug would have a negative charge. Example is protamine is used for treatment of the heparin overdose because the protamine carries a positive charge. So protamine is positive charge while the heparin carries a negative charge. So heparin is negative, and 1 milligram of protamine can neutralize 100 units of heparin. So protamine is the heparin antidote. Also we have the physiological antagonism, and that's when antagonism between two drugs producing opposite effects by activation of different receptors. So the physiological antagonism involves antagonism between two drugs that are producing opposite effects by activating different receptors. Example would be the glucocorticoids. Drugs lead to increase in blood sugar, and this effect physiologically antagonized by giving the patient insulin. So insulin is the physiological antagonist for the glucocorticoids. Finally, we have the pharmacokinetics antagonism, and that's when drug antagonize other drug in the pharmacokinetics, meaning the absorption, distribution, metabolism, and elimination. And example for that would be the absorption. So when a drug antagonizes other drug in the absorption process of the pharmacokinetics, example for that when taking antacids with iron supplements. The antacids would antagonize the absorption of the iron, and that's in the absorption process. Example for the metabolism process, some drugs increase the metabolism of another drug, like the rifampin, leading to increase the metabolism of the contraceptive pills, and that's by rifampin affecting the CYP enzyme. So it would increase the CYP enzyme activity, and this would increase the metabolism of the contraceptive pills. And in the excretion, that's when the patient taking aspirin and give them the NaHCO3, the sodium bicarbonate, effervescent. The aspirin excretion increases because the sodium bicarbonate alkalinizes the urine, and that's lead to the aspirin getting trapped by ion trapping into the urine, and it will get excreted. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe, and if you want to support more, you can by subscribing to the Patreon link provided in the description of this video. Thank you for watching and see you soon. Peace.